Thank you so much for joining us today. I'm Cindy McGarry, and I have Tabitha Blunt here with me. And we are going to go over our orientation for the Clinical Psychology Internship Training Program at UT Health San Antonio. So the objectives, the things that we're going to cover today, include an introduction to the directors, the philosophy and mission of our program, the goals and objectives of training, our training overview, our generalist activities and our track activities, the sites within our program, and a week in the life of a UT Health intern. And so, like I said before, I'm Cindy McGarry. I got my PhD at Texas A&M University, and then I did my internship as an active duty Air Force captain at Wilford Hall Medical Center here in San Antonio. I'm board certified in behavioral and cognitive therapy. As part of my role at UT Health San Antonio, part of my time I spend running the internship training program, and the rest of my time I'm engaged in research. And my research interests include polytrauma, post-traumatic headache, PTSD, and pain in primary care. I also provide service to the university, and so I serve as an IRB chair. I am the residency training committee co-chair. I'm an ABIP examiner and mentor. I'm a commission on accreditation site visitor. And what that means is that I help the APA go around to other internship training sites to make sure that they're following the rules the APA has outlined. And it's a really nice way to build community, to meet other training directors, and to get some really neat stealable ideas. I also serve on our Research Quality Improvement Day Committee, and I'll talk a little bit more about that later on. I'm also on the APA panel for the clinical guidelines of chronic musculoskeletal pain, and I serve on the APIC DEI committee.
Hi, I'm Dr. Tabitha Blunt, and I'm the Associate Training Director for the internship. I received my PhD in clinical psychology from Texas Tech University, and actually came here for internship back in 2010. I stayed on and completed a 2-year postdoc at the university with Strong Star, which is one of our rotations. And then I'm involved in not only the internship, but also a variety of clinical and research enterprises. So within the university, I work for Strong Star, where I provide both clinical supervision as well as clinical services within our research studies. I also have a small clinic where I provide behavioral treatments for children and adults with tic disorders. I'm also involved in the running, training of parent-child interaction therapists through our PCAT clinic. In addition to that, I am also engaged in research with adolescents that are experiencing traumatic symptoms, service members, again, through Strong Star service members and veterans who are dealing with PTSD. I particularly enjoy working with couples that are dealing with post-traumatic stress disorder. And then I've had the pleasure and privilege to work with Dr. Cindy McGarry and her husband on chronic pain research as well. For service, I serve as our internships training committee co-chair. I am an APA site visitor as well. I am part of the department's Research Quality Improvement Day Committee, and then also serve on the Educational Opportunity Advisory Council for the School of Medicine. And then I also teach couples and family course at UTSA.
So here's our program's philosophy and mission. Our program has a foundation as a scientist practitioner program consistent with the Boulder model. And I'd say we're probably more heavily on the practitioner side. And we maintain a generalist perspective despite having very specific tracks within our program. So these are our training goals, and they should look really familiar because they are what the APA requires. Any APA accredited internships, doctoral programs, or postdocs will all have these 9 training goals. And so the first one is research. And it's not just conducting research, but how to read the research and use it to develop your own treatments and to apply to your patient care, ethical and legal standards, individual and cultural diversity, professional values, attitudes, and behaviors, communication and interpersonal skills, assessment, intervention, supervision, and consultation and interprofessional interdisciplinary skills. As an overview of UT Health training, we have seminars that are both track specific and generalist in nature. We have our practical clinical experiences, which include our sites that we provide care. We have supervision where you have at least 4 hours of supervision per week and oftentimes more. We do case conceptualization, which we really consider as peer supervision during some of our weekly lunches with the training directors, and we have those catered in. Some of our sites you are able to supervise either master's or doctoral level students, but not in all of our sites. And so that's where we really utilize that peer supervision. And then we have a research and quality improvement day. And what that is it's a really nice way for our interns to showcase their research. And so all of our interns will prepare a poster, and we pay for that in the department. Most times our interns will do that on their doctoral dissertations, but it can be de novo research as well. And then we'll have anywhere from 1 to 3 of our interns do short oral presentations to our faculty. Those interns end up being our research interns of the year, and they get a nice plaque at the end of the year and are able to put poster presentations and oral presentations on their CV. And we also have a DVP that comes in for the day and provides a grand rounds. We have a data blitz with our faculty, so you get to know some of our faculty better and the research that they're doing. And so it's really a nice way to showcase some of that more scientist side of the scientist practitioner model. Our UT Health training activities are both general and track specific. And so Tuesday mornings tend to be the day that you are at UT Health with us. And so that's your more generalist training. We have our Tuesday AM seminars that usually start about 8:15. And that's where all of our interns are together. We'll have 9 interns over the course of this next training year. We have patients that we'll see in the advanced clinic on Tuesdays. And so that's usually 1 to 2 patients seen in our community clinic. We have our director's lunch. That's on Tuesdays from 12 to 1. And that's what we have catered in, where we all eat lunch together and we do a variety of activities that include peer supervision, presenting dissertations, those sort of things. Sometimes it's just social time. And then we have a year-long elective. And right now our year-long electives include a pain research elective, parent-child interaction therapy, and teaching a DBT group. And then we have our track-specific activities, which include our major rotations. And so you're with us at UT Health on Tuesdays, but the other days you'll be at your specific sites. And so Monday, Wednesday, Thursday, and Friday. We have afternoon seminars that are track-specific. Some of those are on Tuesday afternoons, depending on the track, and some of them are on other days. And then we have a preceptor or mentor model. And so the preceptor are individuals who are really there to mentor you, to help you make it through the program. If you're having any professional issues, to really help you guide through with your dissertation, your postdoc applications, your next steps. Sometimes they're your supervisor in the advanced clinic, but not always. And so we find that that's a really nice way to build some collegial mentorship relationships within the program. The benefits of our program one is that we start really early. We're probably one of the earliest. We start July 1st, which means we end really early on June 30th. And so sometimes that allows folks to have a little bit of a vacation before starting postdocs, which can be really nice and beneficial. We provide health insurance. And so if you wanted health insurance for your partner or your children, you pay for that, but at least for individual health insurance, we do provide that. We have a very nice leave policy. And so our paid time off includes 128 hours of vacation. We have 12 holidays a month. We allow our interns to also use an admin day over the course of the year, and that can be used for dissertation defense, graduation, postdoc interviews. We also have a travel fund of $500 that allows our interns to travel a little bit, or sometimes they'll do online trainings with that fund as well. We have a $100 book fund, so our interns can start building their own professional libraries. We have library services on campus, and so with that, you are able to get all online journal articles, those sort of things. And then our stipend is $30,500. And so we also provide an EPPP training package to our interns, which our interns have found really beneficial. They don't have to use it over the course of our training year. They can implement it and start it after the training, but they do get to use that training package to get them ready for the EPPP. And because of our leave policy tends to be really very flexible, because on top of the leave policy, the 128 vacation days, the 1 admin day and the 12 holidays, you also get a day of sick leave a month. And so because of that, if you were to add all of that up, you'd almost have a month off of the internship over the course of the year. And APA requires that you have a 2,000-hour internship. And so because of that, our weeks tend to be a little bit longer at about 45 hours. Most of that is made up through an evening group, either if you're part of PCIT or if you're part of the research elective or DBT. Those tend to be done in the evening hours, but tend to be about 45 hours a week.
Another benefit of our program is that it's actually located in San Antonio, Texas. For those that have visited, you recognize hopefully what a wonderful metropolitan area San Antonio is. For those that are not, I'd love to just highlight what it's like to live in San Antonio. And so San Antonio is a large city, but it's sprawling. And so you don't have the traffic that a lot of other more compact cities have. It is a great place to visit because we have a lot of different attractions. So we have our historic Riverwalk, and we have several historic places that I think are really neat to look at. So we have obviously the Alamo. We also have the Missions. In addition to the historic downtown area, we have a lot of theme parks in San Antonio as well as around the San Antonio area. And so we have SeaWorld, we have Six Flags over Texas. And then within a 45-minute drive, we also have Schlitterbahn, which is one of the larger water parks in the nation. We also have, I think, just really cool places to go visit. So we have a Japanese tea garden that's within walking distance of our San Antonio Zoo. We have wineries that are like scattered around. We have our own sport team. So we have the Spurs. And so we have sporting events that occur. We have a lot of concerts that come through San Antonio. Austin is another large venue for concerts. And so that's about a 90-minute drive. So definitely doable over the weekend. We have wineries that are within a 1-hour drive. And then we also have a lot of walking trails like built within the city where you're in the middle of the city, but it still feels like you're really out in the middle of nature. In addition to that, we have the natural caverns that are, I think, about an hour away. And so all that's to say, if you're like an indoor person, obviously lots to do, lots of shopping. If you're somebody that likes to go to events, we have lots of fun events. If you're somebody that's more outdoorsy and likes to hike, there's a lot of places to do that as well. We also have what I would describe as kind of San Antonio's version of Mardi Gras, which is a fiesta that comes in every year, where there's parades and there's like oyster bakes and a lot of different like fun activities. So San Antonio is a fantastic place to live. I think what's nice is it's a city that can accommodate a lot of different family makeups. So if you're coming in and you're single, we encourage you to connect with your fellow interns and really explore all of the benefits of the city. If you're coming in partnered, there's a lot of fun things to do. And if you're coming in with children, there's lots of really like child-friendly places and activities to engage in. And so again, I've lived in a lot of different places. I was an Army brat and I highly recommend San Antonio. I absolutely love living here. I mentioned if you have family, obviously, Cindy and I won't ask you about whether you're partnered, if you're married, if you have kids. We do recognize as individuals who, value both our work and our family, that can play an important role in decision making. So when you are invited for an interview. We're going to send out information for people who are in our program that have children, so that they can talk to you if you have questions more discreetly, kind of outside of the interview process, about what it's like to have a family and be an intern here at UT Health San Antonio. Okay, so I'll move on to the next slide. All right, so I want to just highlight the tracks and the rotations that are associated with each track, to provide an overview. That being said, I do encourage you to look at our website and then to please attend our open houses, where you'll have a chance to talk not only with Cindy or myself, but you also have a chance to talk with track coordinators, site supervisors, as well as interns. Again, our goal is to give you as much information as possible so that you can make a decision that fits well with your training goals and with your personal life. So our internship has 3 different tracks for this upcoming year. We have the CBT track, we have the integrated primary care behavioral health track, and we have the forensic track. I will start with our largest track, which consists of 5 interns, and that's the CBT track. This track is different from our other 2 in that interns that match with the CBT track will go to 2 6-month rotations. Interns that go to our integrated primary care behavioral health track will go to 1 site for 12 months. That same setup is also true for our forensic track. So here you would be matched with within CBT, and then you would be assigned to 2 of the 4 different sites. Our Strong Star site is housed within the Department of Psychiatry and Behavioral Sciences. It is a research organization that has been funded since 2008 to study different treatments and assessments for trauma-related conditions, including PTSD. That tends to be one of our biggest emphasis. That being said, over the last 16 years, we've also expanded to cover a lot of co-occurring conditions, including insomnia, relationship issues, suicidality, substance abuse, chronic pain. And so it's not just post-traumatic stress disorder. But you will get a lot of training in that. Our interns that rotate at Strong Star have an opportunity to experience firsthand what it's like to do grant-funded team science. You'll receive training in evidence-based treatments for PTSD. Those vary from year to year. The trainings vary from year to year depending on what studies are currently up and running. Our current interns are getting training in prolonged exposure as well as written exposure for PTSD. There's also opportunities to receive training and assessments. And that would include the CAPS-5. We also train on suicide assessment as well as crisis response prevention. For those that are interested, there's also sometimes an opportunity to dip your toe into TIC work because, again, I'm a supervisor for Strong Star. So when things are a little bit slower, we have individuals that are interested in continuing work with kids. I sometimes will try to carve out some extra training there as well. With Strong Star, you have an opportunity to interact with postdocs as well as interact with research assistants, project coordinators. We also have grad students that are coming in who are more research focused. They're coming in from UTSA. As of right now, though, there are not opportunities to provide supervision to practicum students. Our next rotation is the Transitional Care Clinic. This is a clinic that's supervised by Dr. Dave Roberts and Dr. Fei Lee. The Transitional Care Clinic was grant funded many years ago to help individuals that were being released from inpatient psychiatric services and provide a catchment area for them to receive services while they connected with outpatient, longer term outpatient services. It was put into place because we know that individuals coming out of inpatient psychiatric services are sometimes at an increased risk for self-harm, but that getting access to outpatient care can be timely and difficult. So the transitional care clinic provides, again, a really nice place for people to get care. Given the nature of the transitional care clinic, you do have the opportunity to work with individuals that are dealing with higher levels of serious mental illness. So patients that are seen in the transitional care clinic may be experiencing significant depression or anxiety, but may also be experiencing mania associated with bipolar disorder, or dealing with psychosis or suicidality. So I think it's a great way to receive, again, lots of training and supervision on how to deal with individuals that are dealing with both acute as well as chronic psychological disorders. Within the transitional care clinic, you have an opportunity to work with other psychology interns. There's 2 that rotate at a time. But you also have an opportunity to work with social workers, with psychiatry, and then with other mental health professionals. And so it's a great opportunity to work within an interdisciplinary team. In addition to working with the interdisciplinary team, they often have master level practicum students that are working within the transitional care clinic. So there's opportunities to potentially provide supervision. The TCC really emphasizes DBT training as well as trauma-informed care. And so a lot of the interns there will receive training not only in DBT, but also cognitive processing therapy. I guess the final thing I'll say about the TCC is it's, I think, a really nice opportunity to work with individuals that are often lower resourced. And so getting to really reach out and support and help the community. Our third rotation is the San Antonio State Hospital. That is supervised by Dr. Heather Holder. The San Antonio State Hospital is an inpatient facility that recently actually moved into a new building. So if you go there, you'll be working in a really nice facility. They have different units that work with different populations. The units have varied from year to year, but more recently have really focused on providing a forensic training. And so if you're kind of waffling between the forensic track or CBT track because you have interest in both, SASH can provide a really kind of nice middle ground between the 2 tracks and getting that inpatient experience as well as getting some more forensic training. This is another opportunity to work within an interdisciplinary team, so working with psychiatrists as well as other mental health professionals. This is probably the one where you'll have the most exposure out of the 4 sites with assessments. I'd say that our CBT track by and large is more treatment focused than it is assessment focused. The assessments that are typically done across the others tend to be either study-based for Strong Star or tend to be more treatment outcome measures and screening tools. So that's just something to be aware of. But San Antonio SASH or San Antonio State Hospital is the one where you're going to have, again, the most opportunity to get exposure to testing batteries. As of right now, I'm not anticipating that there will be opportunities to supervise a practicum student at San Antonio State Hospital. Our final site for CBT is our Student Counseling Center. And I think what's nice about our Student Counseling Center is it is often a different experience than what people typically get from their graduate program. So a lot of grad programs are going to focus on undergrad populations. Because the Student Counseling Center is here at UT Health San Antonio, you have the opportunity to work with not only med students, but also residents and fellows, because they tend to be an older, slightly older population you're getting to deal with slightly different issues. There are opportunities to do individual treatment as well as couples treatment. There have been opportunities to also do outreach within the university, which I think is a really nice skill to develop as a up and coming psychologist. I think this is also one where you get exposure to a lot of diversity because we do have a large international student population within UT Health San Antonio. We do have psychiatry that rotates at the Student Counseling Center as well. So there's opportunities again to work from an interdisciplinary frame. This is a site that has brought on past interns and kept them as postdocs or faculty. I'll also highlight that that has happened at the Transitional Care Clinic as well as Strong Start and actually SASH. So these are rotations that in the past have taken on interns. I know it feels a little early to start thinking about that, but it is always a good question to ask about what long-term opportunities look like. Right. Our second track is our integrated primary care behavioral health site. This is going to have 2 interns. Both interns will be rotating at the Department of Family and Community Medicine. It is a 12-month rotation. This is an excellent opportunity to receive training in the behavioral health consultation model. And so you'll have an opportunity, obviously, to work in a disciplinary team within a family medicine clinic. This is also a great opportunity to provide supervision. So our interns work directly with family medicine residents to provide supervision and training from a psychological perspective. And then also learn from them more of the medical perspective. They also have practicum students that rotate in through the Department of Family and Community Medicine. And so there's opportunities to work with master level professors, master level trainees as well. Sorry about that. I think this is a really great opportunity to also potentially exponentially expand your knowledge of medicine, of medical disorders, and then how you can collaborate with medical professions to provide more holistic care for individuals. This is also a great opportunity for interns that are interested in providing Spanish speaking services to patients. And so we do have supervisors that are built into the track that are able to provide supervision in Spanish as well as services in Spanish. And then our final track is our forensic track. Again, we have 2 interns that will rotate at Kerrville State Hospital. Kerrville State Hospital, just for your awareness, is about 50 miles outside of San Antonio. And so as you think about that track, it's just, I think, important to think about where you may want to live. We've had interns that live in San Antonio and then travel to Kerrville. We have interns that stay in Kerrville and travel to San Antonio. I will say it is located in a very beautiful kind of mountainous area, located in a small town. The Kerrville State Hospital was originally built as a nursing facility and then I think a TB hospital. And so it really doesn't look like a prison, even though it is housing individuals that were either found not guilty by reason of insanity or not competent to stand trial. But it's a beautiful campus. It's not surrounded by barbed wire. It's actually really, really nice. Over the course of your 12 months, you'll have the opportunities to engage both in terms of forensic assessments as well as providing group and individual treatment to residents at Kerrville State Hospital. I think what's also nice is that this is another track that provides that opportunity for supervision. So you generally will have an opportunity to work with a master level practicum student that's rotating through Kerrville State Hospital. Kerrville also provides a lot of opportunities to engage in active trainings. And so Kerrville State Hospital is paired up with Baylor Law School, and they will hold a mock trial where you'll be given a case that you have to then go and provide testimony to. And then you'll get to interact with law students that are trying the case. And so you get that kind of real in vivo court experience before you necessarily have to do that in a professional way. And then you get feedback. Sometimes they do that once, sometimes they do that twice over the course of the year. They also offer hostage negotiation training. They host their own forensic conference, so getting to hear from other individuals within the state, I think is really nice as well. Again, an excellent training. Probably not doing it the full justice, so please make sure that you come to the open house. All right, so getting to some of our final slides. So this is a week in the life of a intern. We have 3 different slides here that will highlight CBT, primary care, as well as forensic. By and large, these are going to take the same format. So as Cindy's already mentioned, Monday, Wednesday, Thursday, Friday, you'll be at your major rotation. So that will be the same rotation again for Kerrville and for family medicine. For CBT, that's going to be the same rotation from July into December, and then you'll switch rotations from January until the end of June. And so again, you'll be there Monday, Wednesday, Thursday, Friday. On Tuesdays, you'll join us, or you'll participate in a morning seminar, and then a lunch with Cindy and I that we have catered typically for our interns. And then the rest of the day, you'll be spending time in individual supervision for your advanced patients. You'll be assigned 2 advanced patients that you'll see on Tuesday. And then you'll also participate in a track seminar, and then meet with your advanced clinic supervisor or your group supervisor, or again, your preceptor. So like the when varies a little bit from intern to intern, but what it consists of is fairly similar across the board. Then we'll move on to our primary care track. Again, it looks very similar. They also have their track seminars on Tuesday, and so a very full day. And then if we move over to forensics, we'll notice a slight difference here. So again, you'll be doing group supervision, individual supervision, definitely doing your group experience so that you're not having to go back and forth on Tuesdays. The one difference here, though, is your seminars are held at Kerrville on every 1st, 3rd, and 5th Thursday, and it's an hour and a half at a time. In case you're wanting more information about the individual tracks, again, you're very welcome to reach out to Cindy and I. You're also welcome to reach out to our track coordinators, including Dr. John Mooring for cognitive behavioral track, Dr. Stacy Obeid for integrated primary care behavioral health track, and then Dr. Miranda Upton for our forensic track. And then that actually brings us to the end. Again, we so appreciate your time and attention as you watched our orientation video. Again, we hope to see you at open houses and look forward to learning more about your training goals.
Please reach out if you have any questions. Thank you.